But Lyme disease is a very common tick-borne disease in Minnesota. Back in February, the CDC reported nearly a 70% jump in cases.
Really? Leif Sundberg with Entira Family Clinics is joining us now to learn more about the signs of Lyme disease that you want to look out for this summer. Okay, nice to have you here,
yes.
sir. You're so charming and pleasant. This topic, not as much.
No, but it is a necessary evil to talk about because it's very prevalent in Minnesota. Ticks, Lyme disease, Minnesota, they kind of all go together.
So Minnesota, Wisconsin, I know we talk about Connecticut because Lyme, Connecticut is where this was first kind of discovered. Those are really the state, I mean, we have like the highest levels in the country.
Yes, comparatively to the Northeast, Minnesota, the Midwest, we're up there in regards to the tick-borne illnesses as well as the transmission of Lyme.
Oh, God. So what exactly? We've heard about Lyme disease for a really long time. I'm not even sure I even know what it is. I hear about people saying, hey, I think I have complications from Lyme disease, but I don't actually know what the disease is.
Right. So later on we can kind of go through the complications. Real quick facts with Lyme disease is caused by the Borrelia bacteria. Infection occurs through the black-legged tick, aka the deer tick. Most tick bites are, though, by the American dog tick, which rarely spreads disease, and tick bites typically occur between the months of April, July, as well as September to October.
Oh, interesting. Okay, so the difference between deer ticks and those dog ticks.
Yes. Try to keep it simple, okay, for the viewers. Deer ticks are smaller, okay? As you can see on the screen there, in the upper left, we have a female deer tick. Those are the ones that transmit Lyme. They're smaller. They got that red-orange torso. They got black legs. I will say, though, when they get engorged, it can be difficult to distinguish between the differences between the two.
I don't like that word. Anyway,
I know.
but they're like poppy seed size, right?
Yeah, they're small, yep. And you can see a dime right there. They're small, okay? They're hard to pick up. But especially if you are exposed in wooded areas, just making sure you're doing tick checks to try to find those little guys.
Okay, so basically my advice, I'm not the doctor here, but my advice, if you see a tick, I don't care, don't try to name the species, just get it off your body.
Yep, okay? That's number one, take it off. Yes, exactly.
So just take it off.
Yep.
So, but not every tick has or carries this bacteria, correct?
Like I said, deer ticks are the only ones that carry Lyme, but only around 25 to 30% carry Lyme disease, and that does kind of change with specific regions. To transmit Lyme, though, a deer tick does have to be attached for about 24 to 36 hours to transmit Lyme disease. So it's not a quick bite to get Lyme. It has to be there. It has to transmit fluids and get that into you. Yep. And the amount of engorgement, sorry, I'm using that word again, is dependent on the time the tick has been attached. So as the tick is on longer, it gets larger. So if you pull off a tick, it's not engorged. Pretty rare that Lyme disease will be transmitted.
Guys, when the gates of heaven open up, first question has got to be, what's with the ticks, God? Like,
Why do we need them?
The ticks. It's just
what
wild.
animal out there feeds exclusively off of ticks?
Oh my gosh, I do know guinea hens love to eat ticks. Also, having backyard chickens is really great because they also eat ticks too. So, as you know, I am on a mission to try to get every house to come with a chicken coop, and maybe I can help
lower the tick population.
The propaganda is coming right here.
Exactly.
Okay, so if you've been bitten by a tick and you find one of these disgusting engorged beings in your skin, what is one to do besides panic?
Take it off. All right, number one, get some tweezers, get close to the head, yank it off the skin. Try to identify what tick it is from the information before, deer tick versus a dog tick. Try to identify how long it was attached, okay? And what you can do is use something called the Tick Bite Bot, which is a tool on the CDC website, determines how long the tick has been there, helps you identify what kind of tick it is. If the tick has been attached for more than 24 hours and you catch it within 3 days, you can go to your provider's office, get a prophylactic dose to prevent the onset of Lyme disease, which may occur.
Okay, so this might be a problem in my household because you might, if I'm pulling a tick off of myself or one of my kids, I'm not taking time to identify it. You might need to call CSI because I am smashing that thing on the ground as much as I can.
Fair enough.
But maybe you should put it in a Ziploc.
Put it in a Ziploc bag, take a look at it, use the CDC website to help you identify the differences between the dog and the deer tick.
Okay, but here's the issue. I have heard of a lot of people who say, and I've actually done stories on this in my news days of people with Lyme disease years ago when like they were misdiagnosed or the diagnosis was missed for many years and they were like, something is wrong because they don't remember getting a tick bite, they don't remember finding the tick, and they don't remember having a bullseye rash, which for many years was like the big thing.
Exactly, and still is for, I would say, 3/4 of infected individuals with Lyme will get the erythema migrans rash, also known as the target rash, okay? And in early symptoms of Lyme, which can occur 30 to 30 days after tick bite, include flu-like illness, fever, chills, body aches, you don't feel well, you might get some neck stiffness, joint stiffness, you might have some lymph nodes that might be acting up. The symptoms are pretty vague, but you're not feeling well.
Okay.
Right. Right. So a little fluey, and then you've got that rash as
Yeah,
well.
exactly.
So then how do you treat it then? And how long would it actually, is treatment like going to completely eradicate it and you'll never have issues again, or is it?
Can't
linger?
guarantee that. There are some individuals who may have chronic issues with treated Lyme disease. It's a small portion of individuals. But as far as diagnosing it, the erythema migrans rash, if you have that, you got Lyme, you need to get treatment. And then we play into those systemic symptoms, the fever, body chills, as well as diagnostic testing. However, diagnostic testing itself is not perfect, so we kind of take the patient's history as well as their current symptoms and the lab work to identify, do you have Lyme? And then treatments can be dependent on your symptoms. Longer individuals with more systemic symptoms, you can get some joint pains, heart issues, kidney problems, require a longer treatment, and some most individuals require a 2-week course.
So is it like anything else though, where we're all exposed to things all the time, right? And you always know where like somebody gets a cold and they're down, somebody is just totally, it's just kind of mild and okay. And I always think of that as like susceptibility. Is living a healthy lifestyle, being active, eating well, does that stuff ever help? Like, would it help make you less likely to have severe symptoms if you got it, or
It's
we
hard to
don't
say.
know?
We did discuss this before, comorbid conditions.
Right.
Okay, if you're not healthy, you may have more severe symptoms, but I've seen athletes with severe symptoms. It's a very serious disease and can really take a toll on the body.
It's tricky. This is good
Okay,
to know.
silly question to close this thing out,
Oh,
but
boy.
I'm guessing it's not contagious to anybody else in your family, right? Once you get Lyme disease, it only affects you.
It's not like an upper respiratory disease where you can pass it off to someone.
Yeah.
It's in your blood, it stays with you.
That was a
Good.
good question.
Yeah.
Good to know.
Leif,
Thanks,
good
Leif.
to see you.
Yeah, thank you.
Thank you. Those tick pictures were disgusting. Absolutely disgusting.
All right, we posted a link to that tick bite bot tool we mentioned and Entire Family Clinics as well on TwinCiesLive.com.
Okay.